Hello and welcome back to Mama Flicks Pregnancy Series. In this video, you will learn about what happens at the doctor's office in the first trimester of your pregnancy. Your first prenatal visit may be one of the longest you'll have during your pregnancy, and definitely the most comprehensive. Not only will there be tests and information gathering, there will be lots of time spent on questions and answers. Your healthcare provider will give you plenty of advice from what to eat, what prenatal vitamins to take, and how much to exercise. During the first trimester, you will most likely have just one appointment with your doctor, unless your pregnancy is considered a high-risk pregnancy or if you have other medical conditions. Expect to have the first appointment between 6 and 8 weeks of pregnancy, and sooner if you are considered high risk. The bulk of your first appointment will be going through tests and screenings, as well as questioning you about your medical history and that of your spouse or significant others. A personal medical history will be assessed, including any medical conditions you have, what medications you take, and if you have had surgery before. Once the date is on your calendar, do a little prep work to make the most of your visit. Make a list of key health facts. Your practitioner will want to discuss all the details of your medical history, so check your records at home or call your primary care doctor for a refresh. Come prepared with at least some basics about your personal medical history. Think about the immunisations you've had, previous major illnesses or surgeries, known allergies, including drug allergies, your mental health history, such as history of depression, anxiety disorder, or other mental health disorders, your gynecological history, like what was the age of your first period, details about your cycle, whether you have problems with premenstrual syndrome or premenstrual dysphoric disorder, and whether you've had any prior gynecological surgeries. It is also important to know your obstetrical history, whether you've had any previous pregnancies, including pregnancy complications or losses, and details about previous deliveries. Also think about any potential disease exposure. Consider if there were any contagious diseases you may have been exposed to in the past, like mononucleosis or tuberculosis. Take stock of your medicine cabinet. Your healthcare provider will also want to know the names and possibly the dosages of any medications and supplements you take, herbs and vitamins included. Are there any health conditions that run in your and your partner's families? Learn what illnesses your family has a history of so you can clue in your practitioner from the get-go. You can expect a number of tests during your first prenatal visit. Your visit will most likely begin with a physical exam. Your healthcare provider will weigh you and determine your blood pressure. Your heart, lungs, and breasts are also going to be checked as well. There will also be a pelvic exam during which a pap smear is taken to screen for cervical cancer, and cultures are taken to detect sexually transmitted diseases such as gonorrhea and chlamydia. In addition, a bimanual internal exam will be performed to determine the size of your uterus and pelvis. This exam will also check for any abnormalities of the uterus, ovaries, or fallopian tubes. A series of lab tests that will be performed during your first prenatal visit will include a complete blood count, blood typing, a screen to look for the rubella virus, hepatitis panel, syphilis test, urine analysis, and an HIV test. Your first prenatal visit will also include an ultrasound, which is done internally with a wand that uses sound waves to look at your uterus. This helps determine the position, size, and age of the fetus. Many women don't hear the heartbeat at the 8-week ultrasound, so don't be concerned if you aren't able to hear it by this point. The benefits to an ultrasound evaluation include detection of abnormal pregnancies that are destined to miscarry, enabling scheduled intervention if desired by the patient, and enabling collection of pregnancy tissue for chromosomal analysis. Finally, an Rh antibodies test will be done during your first trimester appointment. This looks for incompatible blood types between you and your fetus. It can be a problem during delivery or even during miscarriage, because your body may produce antibodies to protect itself from this foreign substance. This phenomenon is called Rh incompatibility. If your partner's blood is Rh positive and yours is Rh negative, you will be given an injection of Rh immune globulin during the 28th week of your pregnancy to prevent the development of antibodies that could be harmful to your baby. You will also receive this injection during invasive procedures and if you have any significant bleeding during your pregnancy. Additionally, an injection of Rh immune globulin is given after delivery if your baby has Rh positive blood. Depending on your ethnic background and medical history, you may also be tested for sickle cell anemia, Tay-Sachs disease, and thalassemia. Some groups of people are more at risk than others for these illnesses. All of these diseases can be passed on to the baby because of defective genes that the parents may carry, even if they don't have the disease. Your provider may offer you a test for cystic fibrosis, an inherited disease that can affect breathing and digestion in your baby if you or your partner are carriers. A nuchal translucency screening, or NT screening, is a specialised routine ultrasound performed between week 11 and week 13 of pregnancy. Fetuses with increased fluid at the base of their necks, a spot known as the nuchal fold, may have a chromosomal problem such as Down syndrome. An NT screen is often part of routine prenatal testing during the first trimester, and it's recommended for all women. NT focuses on a small clear space at the back of a growing baby's neck called the nuchal fold. Experts have found that this spot tends to accumulate fluid and as a result expands in size in babies who have genetic abnormalities like Down syndrome. The results from the blood tests and the ultrasound, along with the mother's age, are then combined to determine risk factors for certain chromosomal conditions, such as trisomy 21, which is Down syndrome, trisomy 18, Edwards syndrome, and trisomy 13, Patau syndrome. The nuchal screening efficacy increases when the test is combined with other first trimester screenings, like blood testing. This first trimester combined screening can detect up to 90% of the Down syndrome cases. In about 5% of the cases, the nuchal test will tell parents their baby is at risk for Down syndrome or some other chromosome disorder, when actually there is no risk. This is a nuchal screening false positive. If the nuchal screening comes back with a positive result for a higher risk of chromosome disorder, the mother will be offered invasive testing to determine the specific chromosome disorder and the severity of the disorder. The first prenatal visit can be exciting yet stressful. If you have any questions about these tests or what the test results may mean, talk to your healthcare provider. Prenatal testing helps mums and dads to rest assured the pregnancy is going according to plan. When chromosome disorders are found early, both the obstetrician and the parents will be able to learn more about the chromosome disorder and prepare for any health-related special needs the baby may have after birth. Testing is completely voluntary and not required.